Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the various grip and prehension. So first is spherical grip. It is a most respect to the cylindrical grip but greater spread of fingers to encompass the object. The more activity of the interosseous, for example, holding a ball. Hook grip, a specialized form of prehension, function primarily of the fingers. More activity of FDP and FDS. Load more distally FDP, proximally FDS. Thumb is moderate to full extension. For example, carrying a briefcase. Lateral prehensions. It is the contact between two fingers. MCP and IP joint are in extension as contagious MCP joints simultaneously abduct and adduct. Extension musculature predominates. For example, holding a paper. Next is precision handling. It requires much finer motor control and more dependent on intact sensation. In two jaw chuck, one jaw is thumb, that is when the thumb is abducted and rotated. Second jaw is by distal tip or the pad or the side of the finger. Three varieties of the precision are pad to pad, tip to tip, pad to side. So first is the pad to pad prehensions. It involves opposition of pad or pulp of thumb to pad or pulp of finger. The pad has greatest concentration of the tactile corpuscles. MCP and proximal IP joint of the finger partially flexed. Distal IP joint extend or slightly flexed. Thumb is CMC flexion, abduction and rotation. MCP and IP joint partially flex or extends. For example, holding a forceps. Next is tip to tip prehensions. Muscle activity almost same to pad prehension with some key differences like IP joint of the fingers and the thumb have range and force to create full flexion. MCP joint of opposite fingers deviates underly. For example, holding a pen. Next is side to side prehensions. For example, key grip or lateral pinch between thumb and side of the index finger. Thumb more abducted and less rotated, least precise form of precisional handling. Next is a functional position of the wrist and hand. The functional position of wrist is wrist complex is slightly 20-degree extension and slight 10-degree ulnar deviation. Fingers moderately flex at MCP joint, that is 45-degree, and proximal IP joint 30-degree, and slight flexion at IP joint. Thank you.